Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's quickly understand the types of epithelium. So first is we move on to the simple squamous epithelium. Simple squamous epithelium. The simple squamous epithelium is nothing but the air sacs of the lungs. So it is the air sacs of the lung and lining the heart. And it also line the heart. And also the blood vessels. And also the lymphatic vessels. So air sacs of the lungs, the heart, line the lungs, the heart, the blood vessels, and the lymphatic vessels. So what is the function of the simple epithelium? Simple squamous. So this is simple squamous epithelium. The function is that it allows the material to pass through by diffusion and filtration. So the functions is diffusion and filtration. And it secretes the lubricating surface. So what it does, it secretes the lubricating surface. So this is about the simple squamous. Next we move on to the simple cuboidal. So we saw the simple squamous, now we have the simple cuboidal. So what is meant by the simple cuboidal? Simple cuboidal is nothing but in ducts and secretory portions of the small glands and in kidney tubules. So the simple cuboidal is in ducts. It is present in ducts. So this is the simple cuboidal, is present in ducts as well as a secretory portion. So it is present in ducts and secretory portions of the small glands and in kidney tubules of the small glands. So cuboidal is present in glands. So they are present in glands and also in the kidney tubules. Next, what are the functions of this simple cuboidal? The function is it secretes and absorbs. So it secretes and it also absorbs. So we spoke about the simple squamous, simple cuboidal. Now the simple columnar. Simple columnar. Simple columnar, the ciliated tissues in the bronchi. So there can be presence of ciliated tissues. And they are present in the bronchi. They are present in the uterine tubes. Next, it is also present in the uterus. Then the smooth, there are smooth. In uterus, it's smooth. That's non-ciliated tissues. They are in the digestive tract. The smooth are in the digestive tract. And also this is present in the bladder. Now what are the functions? The function of the simple columnar epithelium is it absorbs, it also secretes some mucous enzymes. So it absorbs and it also secretes. So it absorbs and also secretes, and secretes what? Secretes the mucus, and also it secretes the enzymes. So we spoke about the simple columnar epithelium. Next we move on to the pseudostratified columnar epithelium. So the pseudocolumnar stratified columnar epithelium, it is a ciliated tissue. It lines the trachea. So it is nothing but a ciliated tissue. And what it does, it lines the trachea. So lines the trachea and much of the upper respiratory tract and also upper respiratory tract. So the function is it secretes the mucus and ciliated tissue. It moves mucus. It secretes mucus. It secretes mucus. Also the ciliated mucus tissue. So it secretes mucus and ciliated tissue. It moves the mucus. Next what we have is a stratified squamous epithelium. So the stratified squamous epithelium, it lines the esophagus, mouth and the vagina. So it lines the esophagus, mouth and the vagina, and the function is it protects against the abrasions. So what it does, it protects against abrasion. Then comes the stratified cuboidal epithelium. So stratified cuboidal epithelium is nothing but it involves the sweat glands, the salivary glands and the mammillary glands. So the sweat glands. Next comes the salivary glands, as well as it includes the mammary glands. So what are the functions of this? The function is it forms a protective tissue. So it forms a protective tissue. Next, we have the stratified columnar epithelium. The stratified columnar epithelium. So what is meant by the stratified columnar epithelium? The male urethra and the ducts of the some glands. So it has the inclusion of the male urethra. So the simple stratified squamous epithelium was the lines, the esophagus, mouth, and the vagina. The stratified cuboidal. The stratified squamous was the esophagus, mouth, and vagina. Stratified cuboidal is the sweat glands, salivary glands, and mammary glands. Next is the stratified columnar epithelium. This includes the male urethra and the ducts of some glands, and ducts of some glands. And the function is it secretes and protects. So the function is it secretes and protects. Lastly, what we have is the transitional epithelium. Lastly, we have the transitional epithelium. The transitional epithelium, it lies the bladder and the urethra and the ureter. So it lines the ureter, the urethra, as well as the bladder. So the characteristic is it allows the urinary organs to expand and stretch. So the function is it allows the urinary organs. So urinary organs, and what it does is it expands and it stretches. Expands and stretch. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.